All right, we are rocking. This week, everybody, I have a very exciting podcast. It's been one that we've tried to get together for a little while, and I'm very excited about it due to it's multifactorial. A lot of what's going on in the NFL, a lot that's going on with the atmosphere of strength and conditioning. It's very cool to have somebody that is well researched in her profession about what's going on here. So this week on the NLX2 podcast, we have Dr. Emily Splichal. I'm saying that correct?
You are.
Awesome. I had trouble with that for a little bit. But originally from Dickinson, North Dakota, which is very, very cool. We'll go through her journey a little bit, but originally from here and an owner of I'm wearing them right now. I actually got my wife and I a pair a few weeks ago. A really cool and simple but very effective insole that Naboso. How do I say it again? Naboso. Gosh, dang it. Naboso. Owner of that, owner of EBFA, and also the author of Barefoot Strong. And you have another one possibly coming?
Yep, by the end of the year.
Awesome. That's awesome. So very well read in her profession, very successful, and it's a pleasure to have you on. And if you just want to introduce yourself real quick for everybody that doesn't know you, that's been living under a rock, and we'll go from there.
Okay, awesome. Thank you. So Dr. Splichal, you could just call me Dr. Emily, it's easier. I am a functional podiatrist, human movement specialist. I've been in the fitness industry for over 20 years. Started as a competitive gymnast that I know we'll chat about, and just really passionate about human movement, human performance as it relates to the foot, obviously being a podiatrist, but more so from a sensory perspective. So I'm fascinated on really the neuroscience of movement as it's influenced off of exteroception, or our ability to perceive the external environment. So we'll be diving into a bunch of that stuff, but that's
I really like the aspect of you being a podiatrist, but also going through your residency, and we'll get into that and everything, but being a human movement specialist and really combining those two very, very well. And then you look at your businesses, and you did an amazing job of being a podiatrist and a human movement specialist and making a business out of that. So I thought that was really, really cool. So like we said, originally from Dickinson, North Dakota, so it's really cool to have somebody get out of Dickinson, produce a very great product and business, and then be able to still have family ties to small town North Dakota. So in Dickinson, you were a gymnast, correct? That was your main sport, best sport, only sport?
No, so that was my main sport.
Okay.
And then I did a little bit of sprinting, so the track season, when it's off season for gymnastics. And then with track, I did 100, 200 meter dash, triple jump, and then hurdles. But I'm short. I'm a gymnast.
Yes, exactly.
So it reached a point that I was like, okay, this is a little bit longer leg sport. And then I did a little bit of drill team as well.
So at that time, we've had, I don't know, when you were a gymnast competing here in Dickinson, did you guys have a fairly successful program? Because in the last 10 years, we have been the powerhouse of the entire state. I mean, they've been very, very good.
So we were good. Again, it just totally ages me, but that was quite a while ago. So to remember how I was when I was there, how the team ranked. But we used to train out of a different facility. So now I know that the gymnastics facility is at the high school, which perhaps that allowed additional funding, where it used to be at Heart River Elementary.
Oh, gotcha. I didn't know that.
Yeah. But it was a great program. I know on the Power Athlete podcast I was speaking about being a gymnast, and it just shapes you as an individual. All sports do, but gymnastics specifically shapes discipline, individualized discipline, where team sports are a little bit different. You could say I probably would be bad at team sports or team. Let's come together as a team, where I'm more like individualized because of the nature of that sport.
Yeah, I hold gymnastics with a very high regard. Some people look at it very differently, but I had the opportunity to train for 2 years the DHS gymnast team, and every single one of them, as you would know, every single one of them comes to me and they want me to put biofreeze on their lower back. They want me to roll out their lower back, and they have a lot of lower body issues. But it seemed to me the reoccurring theme was that lower back tightness, and we could get into that. That could be multifactorial. I mean, that could be weak or tight hip flexors. That could be a lot of different things. But I hold it very high because I was a wrestler my whole life, and I played college football, but I was actually a better wrestler. I just liked food. So I never got into it, but swimming, gymnastics, and wrestling teach you more about yourself and life than I think any other sport combined.
Yeah, I love the focus that is taught with gymnastics. And I was speaking to a colleague of mine. This was when I was in residency, but we were speaking about the flow. So the mental flow and focus that athletes achieve, but specifically I was speaking about, how I could get so centered in my mind and literally everything else in the world would just disappear as I was going into a tumbling path.
Yeah.
And then now me trying to tumble at 40, partly besides weighing more, is my mind is more distracted. That I was like, it's more difficult to be a certain type of athlete, let's say gymnastics as an example, when you have to be so focused. Like I can't be thinking about taxes or what I'm
No,
doing the next. Now, interestingly, I'm actually now I do aerials.
really.
So I would call myself an aerialist. I don't perform, but I train 3 times a week doing aerials, and it centers my mind in the same way that gymnastics does or
Yeah.
did.
I I find that also with wrestling is a harder sport to continue throughout your life. But I got into judo and jujitsu, and you hear that a lot, that flow state, being able to shut off everything else in the world. And it even gets into the extremes on either end of the spectrum. Andy Stumpf, he's an ex-Navy SEAL, just a all-around good dude. He's living in Montana. He talks about he skydived all the time. And he didn't like skydiving for the adrenaline. He liked it because you can't think about your taxes. You can't think about your business when you're jumping out of a plane. And so it gets to the other ends of the extremes, but gymnastics is very flow dependent, and I would say wrestling as well. So growing up in Dickinson, this could be inside sports, outside sports. How was it growing up in Dickinson? Because the Dickinson you know is much different than the Dickinson I know. So how was that?
Very much so. Yeah, we probably had half the population from when you were there and didn't have the money of the oil boom that is there now. But I love it. I like it now looking back, where the characteristics that it taught me, and this is especially it. I look at it a little bit different because I now have a child. So
Yeah.
I have a 14-month-old. So the characteristics that a small town feel provided me and the morals and things like that I carried to New York City, living in Manhattan, and just the rest of my life and how I look at, every interaction that I have. I believe a lot of that was shaped from growing up in North Dakota in a small town and, really having that openness and that friendliness that I now love. We just moved to Arizona and I just eat up the friendliness
Oh yeah.
where for a while I was jaded New Yorker, and now I'm
Oh, it's so
suddenly
true though.
Arizona.
So true though. Where are you located in Arizona now?
Just outside Phoenix.
Oh, awesome. That's a great place. I got family in Scottsdale right outside there, so very, very nice place. Um, when when you were in Dickinson and you were obviously very successful in gymnastics, was college gymnastics in the picture?
Yeah, so I had thought of that, and I
Hmm.
actually did 1 year. I didn't go to a university with a strong gymnastics program, but I did 1 year in undergrad. I went to St. Paul, Minnesota, to
Oh, really?
Hamlin, which is a liberal arts school, and I soon realized that gymnastics, there is definitely a life expectancy or like a retirement age,
Yeah.
which is earlier. And I knew that I could not make money off of gymnastics directly as an athlete. So then I had to choose academia. And then that's where I kind of switched. Ironically, what I learned as a gymnast and my passion for movement kind of came back into my life when I got back into fitness.
Mm.
And I knew that that's what was missing in my life is if I just went purely academic, something was missing, part of my soul that I couldn't identify at that time. And then when I got into fitness, that satisfied that void that I realized that it was the movement, which I know we'll speak about. And that I even learned even further when I was just deep diving into my career, still training people and moving and exercising, but not in the same way that fed my soul like gymnastics did. And that's where I got into aerials, and aerials requires the same body awareness and strength as a gymnast because it's all just body weight. You're just manipulating your own body weight through, core and tension and fascia and grip and things like that. That it reignited how I used to feel as a gymnast, which is really exciting to see how that all comes full circle.
I think it's very interesting how that's all connected. You get a lot of people that play high level sports, or even myself. I played here in Dickinson for 4 years, and once you get out of that group or that clique, there's something missing. For you, it was gymnastics, but you were able to kind of stand back and realize maybe it wasn't just gymnastics, maybe it's movement of a certain type, and that's what I've been able to do. I coached football for a year, and I thought that's what I wanted to do, but I liked preparing for the season more than actually playing the season. So that's where I got into what I got into, and being able to instill just the aspect of movement and healthy movement to a lot of these college kids is really cool because, as you would know better than I, is the Dickinson was so small. I'm the very first strength coach ever hired. And so before that, it was, hey, the assistant football coach, who's also the assistant track coach, who's also a professor, writes your workouts. And that's rough. That's very tough. So it's very cool to see that you were able to stand back and just know that movement is what was missing out of that.
Yeah, and that's where I think the listeners, kind of in their own journey, is to be open to what the universe or intuitively you are thinking without labeling it or trying to put a kind of a period at the end of it where allow this continual evolution. And I do that now with my career is I treat a lot of not foot specific injuries because my passion is movement and I'm super curious. And then I got into emotion and interoception and these mind body connections because I just kind of keep allowing that open mindset and the flow and just flowing with life in the universe. It sounds totally cheesy, but really that's where you start to keep exploring passion and keep passion in your career or passion in your days, is to know that it has to constantly be changing and evolving because you do as an individual, and so does your career or focus as well.
Very much so. Being a gymnast, being in the flow state, being able to compete at a high level at that time, was this where your love for feet, because anybody that knows gymnastics, it's very bare, you're very grounded, you could say. So was this where your love for podiatry or being a podiatrist come from?
No, I wish it was that awesome. No, I fell into podiatry by accident.
Mm-hmm.
So I was a personal trainer and group exercise instructor in Manhattan, and I kept getting injured and was kind of seeing some of the frustrations of being in the fitness industry. That from a bigger picture career, I didn't want to just say, okay, I'm going to train or teach classes for the rest of my life because I keep getting hurt. So from a liability perspective, that's not good insurance. So I looked at other career paths that tied in the fitness and the movement that I loved so much, but could have a greater longevity to it, that I could still do it when I'm 70, let's say. And that's why I started looking at medical school or graduate schools. There happened to be a podiatry or a podiatric medical school in Manhattan. And I wanted to stay in Manhattan so I could still be doing the fitness that I loved so much and that fed my soul. So I kind of fell into it that way. And then my sister, my little sister, ironically was, or coincidentally, was a high level long distance runner.
Oh,
I don't even know if her school records. Her name might still be on the high school wall. She broke almost every record at the high
wow.
school when she was there. So she qualified for the Olympic trials, high level distance runner.
Wow.
And she started getting hurt, so she was at the podiatrist a lot. I associated it back to more like running. My sister, I used to go with my sister, but I wasn't connecting the dots. And then it just evolved from there.
Yeah, I mean, a lot of times it comes from a need and you're able to see it from a perspective. You're still being able to help. You're still being able to be involved in movement. And then there was that need of possibly helping your sister or, that's that's awesome. I had no idea she was, that high level of a runner.
You'll have to go to the high school and see if her name is, my last name is still on the wall. It'll be Penny is her first name, Penny
Okay.
Splichal.
Yeah.
If she's still on the wall, I'd be curious.
I bet you she is. I know that in the boys section, a kid named Brady Yoder, he broke all the men's stuff. He I had him on the podcast and it was kind of cool. Me being from small town Wyoming, I had 2 Division I football offers. So it was very minimal. But then I came to Dickinson and I played for free and I played all 4 years. And I had him on the podcast. I was like, hey man, like what were some of your offers? He's like, Oregon, Mississippi State, Cal, all this, like huge school. So it's really cool to have somebody from Dickinson get that opportunity as well. Podiatrist school, you had this really cool, this is what I'm very interested in about you, is you've merged these two worlds that in traditional podiatrists is it's not merged and it's very black or white. And so I'm interested in how you came to this conclusion that you wanted to be a podiatrist because the longevity and you could make a living for the rest of your life doing that, but also you wanting to change the entire industry or change your outlook on the industry with movement. So I'm very interested to see where that paradigm came from.
Yeah, that was again a not planned approach when I started podiatry school. But when I was going through podiatry school, like I said, I was still teaching classes and training clients. So I had a foot, pun totally intended, in fitness and 1 foot in podiatry. My jokes are not funny, sorry. And while I was going through podiatry school, I started seeing that what they were teaching us from a larger movement of the foot in general was very isolated and segregated. So it was starting to become difficult for me to connect what I was learning in school to my clients because they weren't applying it in that way. It's like they didn't see that or connect that. So I started questioning that or knowing that there was more. How can I connect this? And I would try to do it. I started teaching barefoot back then and doing a lot of balance exercises. And then when there were a few people that were speaking a little bit about foot exercises, I would gravitate towards them, not knowing it was a thing,
Yeah.
and would start to implement that just for myself to release my feet and strengthen my feet. Then the further I got into podiatry school and then actually into residency, it became full on surgical. And that's all. It was all day, every day. You just looked at patients from a surgical perspective. And that didn't sit well with me either. I think surgery is fascinating. My family loved to say that, oh, my daughter's a surgeon and all that stuff, but that's not enough to do a career. That I was into my first year of residency, and it was so pulled away from this movement fitness side that, again, it fed my soul. All I'm doing is listening to my intuition and my soul here.
Mm-hmm.
And I became so depressed, like not myself. I was angry. I just hated everything about it. I was like, I don't even want to be a podiatrist. Like, this is not, I can't believe I spent $250,000 in school
Yeah.
and I do not want to do this profession. So I left, actually coincidentally at the same time, I created my first workout. This is a parallel event that is really important. So I created my first workout and shot several DVDs, still during the time of
Yes.
DVDs, was launching that just kind of as like a side hustle while teaching classes and then being a first year medical resident. So I was kind of doing all that at once, right? And I started getting momentum through the DVD and the fitness thing because I was speaking about it about feet. It was foot based. So it was a barefoot balance training workout. Now I happen to spin it for women on heels,
There you go.
which totally different direction than I am right now, but it was barefoot at the time is really what it was. Same philosophies, just not evolved as much. Super unhappy in residency, and I was just like, I need to do something, or I'm gonna need like medication because I'm so angry and depressed and all that stuff. So I quit residency. I was like, I don't know if I want to do this. I just need a minute. So I quit residency, which I would never suggest to anyone because you may never get back in. And then I just burned that bridge and that education. So I leave and I put my energy into this workout, which happened to really take off. And then simultaneously, I heard about this Masters in Human Movement program at HC Skill University, which is here in Arizona. It's an osteopathic school. And I was like, that's fascinating. Like, maybe that could connect it.
Mm-hmm.
So I kind of did those two things simultaneously as I started building my workout, which, got me massive amount of media. I started teaching, was picked up by major gyms. I was on Oprah because of that workout, like a whole thing that just exploded. And then finished my master's, and I was able to kind of have all of that evolve of how I could get fitness. My workout was one example of it, to connect to podiatry and my understanding of feet, and the glue in between those two professions was my master's in human movement. Yeah. I, of course, had to go back to residency to get my license. And thankfully, I found a program that brought me in, took a risk on me, and brought me in because I had a side hustle. I'm just a born entrepreneur, is what I think.
Yes, ma'am.
I was doing my entrepreneurial thing while being a medical resident, and finished my residency. And in my residency, I launched EBFA, which is my education company. Again, running companies while being a resident isn't always recommended. And then from day one that I graduated my residency, got licensed, I left the country for 4 weeks and traveled around Asia teaching my certification that is now under EBFA.
Wow. That's amazing. My sister actually traveled all over Asia for a while. She loved it. She lived there for like 2 years actually. It's a it's pretty cool, crazy culture. Kind of connecting with my wife. So we talked about my wife as an OB nurse. She's in labor and delivery, and I think it's pretty cool. That's why I'm so fascinated with what you're doing, because it's very unconventional, which is sad, but it is very unconventional. But you look at some of the major miracles of Western medicine, and delivering babies would definitely be one of those miracles. But then you also look at people on the whole other end of the spectrum going midwife, and you really find out that if everything goes completely perfect with a midwife, then you're okay. But if one small thing goes wrong, these miracles of Western medicine and science aren't there for you. And so it's finding that fence to ride on, that you're able to have both. And it's just very highly interesting to me, because now I've been able to, through Power Athlete, through my own studies, been getting into the foot health stuff, because we had you could call it a plague of foot injuries 2 to 3 years ago at the football team. And there was multi-factors there. We got a new surface, we had old turf and new turf, and we had a bunch of other things going on, but it was out of a need that I found you in your work. And so it's very interesting to me that you've glued those two together, and that gets me into a topic that I mentioned, was kind of the issues with modern podiatry. And you stated a few times that I've heard, it's not the doctor's fault, because you've been there twice in residency and shown that this is what's fed to you, and whatever you're fed, that's what you are. And so I want to kind of get into one, I guess, the issues that you see with your career path as is right now. And then a very interesting piece in your NSCA presentation was biomechanics, where most of what podiatry is in now, versus neuromuscular efficiency or control.
Yeah, so podiatry gets a bad rap. That I've actually had people say they don't want to take my training or a session because they see the letters after my name, and then they create a negative association with podiatrists, which is unfortunate because perhaps they would benefit from something that I'm saying from a completely different perspective. But in general, podiatry school, medical school, also all professions, so physical therapy, chiropractic, all subsectors of allied health, are taught based off of historical trends, right? So it's just kind of Hippocratic oath, and then it kind of pulls in as far as how we are taught to look at movement, physiology, pathology, and things like that. Podiatry school is classically biomechanical, like you had said. It is based around orthotics, pronation, supination. We must control the foot. We must use these external devices to support the foot. And again, they're just looking at what was taught to them. So I can look at a patient with the frame of mind of how I was taught in school, which is thinking of it based off of orthotic modifications. And I make really good orthotics, not to like pat my own back, but when I do make orthotics, because I have such a passion to understand the foot from a whole body perspective, the modifications that I use are not what everyone would use, which has a profound effect on the orthotics. But if you just look at it biomechanical, you're overlooking a really important side of how the body controls movement. The other side of podiatry, outside of the orthotics, is that they're all taught to be surgeons. So they're looking at it either from an orthotic perspective or a surgical perspective, and that's what's taught in podiatry school. That's what's taught in a lot of orthopedic school, chiropractic school, things like that. And what happens when you do that is you offer every patient pretty much the same recommendation. And if they don't get results, then that's where patients may hear the doctor say, I don't know. Yeah. Right? You're not responding to what I know, so I don't know. I try to look at it from a different perspective, just based off of my own curiosity. Outside of podiatry school, outside of my master's in human movement, I started looking at the pelvic floor. I look at breathing patterns. I studied fascia. I studied the brain. I've studied pediatric development. I've studied what happens when you get strokes and chronic neurological conditions. And then I try to put it all together to create a new perspective for my patients, and then for the education that I teach to other professionals. It is unfortunate of the narrow-mindedness of certain professionals, but again, that's what they're taught. So unless they question it, they're just going to say what they're taught.
Exactly. And you see it in strength and conditioning a little bit too. There's cliques of everything. There's cliques in a lot of different things, but I think due to social media, and that's been a huge factor, you're seeing both ends of the spectrum and both ends of the bell curve, and then you're seeing the people in the middle. And there's so much out there that it's almost an overload. And so that's where I see strength and conditioning being a little bit different, because there's almost too much going on with it, and it's hard to, like Power Athlete, their whole I got to be a Block 1 coach and being affiliated with them, and their whole mentality is battle the bullshit. So weed through everything, and find that light. And so I see what you're doing as that light. And interesting enough, this wasn't planned or anything, but I know this is a very general statement, and that's hard to answer, but I'm interested to know, when you said you make very good orthotics, when is an orthotic necessary?
Yeah. So in general orthotics, I think I've said this on almost every podcast that I'm on, that podiatrist or orthotics for podiatrists it's a moneymaker. So it's what's called practice management. What can you do that is a fee for service for patients to obviously increase your revenue, because you can only see so many patients in a day. So if you want to make more money, you have to look at additional revenue streams. Orthotics is one of those. So if that means you have to give every patient a pair of orthotics, that's what you do. That's not the way that I practice. That's how some people do practice, which is unfortunate. Now, where I look at orthotics is it's based off of the degree of, let's talk about pronation. The degree of pronation, or which part of the foot is pronating, and what is the driver to that pronation. So you have, without being too technical, the back of your heel, which is the subtalar joint. People may be familiar with that, right? It kind of goes out into eversion or inversion, but the back of your heel can pronate, or the middle of your foot, like your arch, can start to pronate. Those are two different types of pronation. Call one a midfoot collapse and one more like a rear foot eversion, or instability in the rear foot. Rear foot eversion or instability of the back of the foot, the ankle and the subtalar joint, that is better controlled through glute strengthening. Strengthening the small muscles of the foot, getting the extrinsics of the foot to strengthen, get your core, foot to core sequencing. Everything that I teach through EBFA is really effective for rear foot instability or pronation, because usually it's a weakness, a muscle weakness. The midfoot pronation or a midfoot drop, a midfoot collapse, oftentimes that is based around hypermobility of the tissue, ligament laxity, things like that. It's much more difficult to try to strengthen muscles to try and control ligament laxity and forces going through that part of the foot. Yes, you can strengthen the posterior tibialis. Yes, you can strengthen the intrinsic muscles, but at the rate that an athlete is sprinting or jumping or something like that, it's just very difficult. You're going to tear through some of that connective tissue. I will look at more midfoot issues as the determinant for orthotics.
Okay. So interestingly enough, your company, your education company, EBFA, I think you, very simply put, you have a gift, and you have a gift to be able to teach people a very elaborate science and make it digestible for them. And so I know through EBFA, you can have, this is a private company, you can have people sign up for your education. Is there any thoughts, or are you just going to keep on pushing EBFA? Are there any thoughts or plans for you to try to implant and impact the educational model for podiatrists going forward? Because I think EBFA, as inclusive as it is, you can teach people that want to learn, but the people that are getting into podiatry have to go through the loophole. They have to go through school and residency. So has there been any plans? Have you thought about that, about how you can impact going forward, or are you just going to keep on preaching the good word of EBFA?
Yeah, no, I actually did think of starting something. The way that I would have to do it, though, would be through, let's call it the American Academy of Functional Podiatry, or something like that. Like I would have to create a entity that creates fellowships and conferences, continuing education for podiatrists specifically, like you're saying. And absolutely, that is one of my life goals, career goals, is to do that. You had mentioned briefly about Naboso. That is my current animal. And our goal is to grow it, but to get it acquired. So I didn't wake up one day and say, oh, I want to be a CEO of a product company and I'm importing and doing distribution, the logistics of a company like that. Product companies are very different animals than education companies, than medical practice. And so I came into Naboso as a way to further my message, not to run that for the rest of my life. So I want that to positively impact people's lives, get it acquired so that I can further impact the next wave of podiatrists, like you're saying. And I would do it built around exactly what we were speaking about, this holistic, integrative, alternative, whole body, fascial, breath, pelvic floor. But I would take it even further and have these podiatrists understand the importance of stress levels, your gut biome, inflammation, mind-body connection, sleep patterns. Like all of that stuff influences the way someone moves, the way that someone recovers, the way that someone experiences pain. Most of my patients happen to now be chronic pain, chronic movement disorders, or chronic movement dysfunction. That's most of my patients. So I want to use that to then create this broader perspective of the podiatry profession, because I agree with you, it has to start on, there has to be something on that side as well.
Yeah.
You can't just have strength and conditioning coaches, chiros, physios that are open and appreciative of the foot holistically. It still has to be the medical specialist of feet with the white coat that also appreciates what they're looking at.
Yeah.
Otherwise, you're just going to keep butting heads, and the patient or the athlete gets confused because they hear one thing here and another thing here, and they don't know. And then some people, not everyone, some people will say, doctor, trust doctor, and then not take weight with what you say, which isn't fair either, because doctors are humans just like everyone, and they make mistakes and they're biased.
Yeah.
So, yeah.
I see that in many different factors. You see it in physical therapy, you see it in chiropractic, and there's spectrums of both. There's people on both sides of the coin. Let's get into Naboso a little bit. I want to kind of tell you my experience I've had with them a little bit. My wife, being on her feet 12 hours a day, she loves it. I mean, you know how it is with a lot of the medical profession, especially nurses. They are told, hey, you need to get Brooks, you need to get Asics, you need to get this Ultra Cush, this great shoe. And to some extent, I get that. And on the other extent, we've been able to put the insole in her shoes, and she absolutely loves it. I, myself, same concept. I'm just moving a little bit more. I have the gym and the college, and that in itself is 12-hour days on my feet. And so a cool thing that I've come to realize with the insole is not the energy level is higher, but the biggest thing is once I take them off, once I get barefoot in my house, I can feel way better. And it's not all in my head. It's not placebo. I can feel our carpet way better. It feels like it's brand new carpet, and I can feel so much more. It's very cool because I didn't expect that coming in. So it was definitely not placebo. So I've had amazing results with them. I have a very wide foot box at the Met Heads. I have very wide. And so I used to wear strictly regular Vans. And I just did a video of it. Every single one of my pair of shoes would rip on the very edge on the medial side of those shoes. And so I had to go get Vans, but they make them wide now. So I have a wide shoe, a little bit more surface area, and I put the insoles in, and it's been amazing. So I want to hear your side of things of Naboso and how it came to be.
Yeah, awesome. I'm so glad that you shared your experience. And so many people say that about the carpet.
Seriously, it's crazy.
Yeah, they'll wear the insoles and be like, "Okay, that's interesting, cool, okay," and then they'll take them off, and then they get their full experience or understanding of them, which is why we recommend wear them for 30 minutes, then take them out and just listen to your body assess. And most people will say, "Well, that's crazy. Give me the insoles back."
Mm-hmm.
But so Naboso, for those who are listening who are not familiar with the Naboso product line, is we have insoles, mats, and flooring. And all of our products have a texture where there's tiny little pyramids across it. I think you're videoing this.
Yes.
So there's tiny little pyramids across it that you can see. And if you are not watching the video, think of it like Braille. So there's little pyramids instead of the dots that are across the entire surface of the mat, flooring, or insoles. The little pyramids stimulate a very specific nerve in your feet that is sensitive to what's called 2-point discrimination. So you feeling the difference between the two pyramid peaks stimulates this nerve, which then talks to the brain, the part of the brain that controls movement, and it then builds foot awareness, body awareness, kinesthetic awareness, balance, posture, gait, force, timing, stabilization, etc. It has applications in performance, which we have a lot of professional athletes that are using it. It has application in medical, meaning people with plantar fasciitis or people who had a stroke, things like that. And then it has application similar to your wife. So people who have to stand for work. So we'll call that occupational health or ergonomic wellness. Those are the three categories that we're in. And it's a new thought for a consumer to think of an insole is totally flat. Right? I didn't add that also with the insoles. It's completely flat. It's 2 millimeters thick. So we want individuals who hear the word insole to start thinking that it doesn't have to have structure, support, and an arch to it. And that an insole could be as simple as this, thin sensory layer that you add to your shoe. So if you don't need an arch support, or you don't need structure, or you don't believe in structure, you don't believe in supportive shoes, which I totally get that, you could still benefit from this additional sensory input to your shoe, because all shoes, even the most minimal shoes, create a sensory disconnect between your body and the ground. And that's where you get your sensory stimulation to control your movement, is by feeling, communicating, correcting, and being synergistic with the ground. We try to bring that into the shoe.
Very impressive. Just selfishly for my brain, what is the difference? So I got the performance-based shoe. What's the difference between your performance line and your, say, activation line?
Yep, the performance has more the Braille dots. So it's a little lower profile on it. See, they're more round dots. Mm-hmm. This one we say is for when you are in your cleats, you are running, you're doing ballistic movement. So we lowered the texture to decrease friction, so that we obviously don't want an athlete or an individual to get a blister. The blue one, which is the activation, which I've shown was the pyramids, this one is for priming your nervous system, recovering. You could use that one when you're doing, your different Olympic lifts, or you're in, strength and conditioning facility and you're doing in that pattern. Mm-hmm. Or for people who stand on their feet, we would say to do the activation. That's our top selling insole. So we have the red one for ballistic movement, and then we have another one which is gray. It's our neuro. That's our medical grade one. That one is our highest level of stimulation.
Oh, interesting. You said the activation is your best selling? Okay.
Yep, the blue one.
Cool. So outside of that, like I said, my personal experience with them have been very positive, highly positive, and I'm excited to see, not that my wife has to work 12-hour shifts, but excited that she gets to experience those here soon. So another thing that I caught on to your teachings, and I saw a parallel, so I thought I would throw it at you, is your definition of a power position. The most stable the foot can get. And correct me if I'm wrong, it'd be plantar flexion, inversion, and external rotation was your basic definition of that, correct?
Yes, which is the lever position of the foot.
Okay. So then we get into the teaching of Power Athlete, and they have this lifestyle of a toes forward lifestyle, and it means a lot more than just the quote itself. John, being able to watch anecdotally over 10 years in the NFL, he showed that people that were able to keep a toes forward position without taking what's called a bucket step in football, just externally rotating the hip. And so what they talk about is people that are able to hold that position are able to produce more force, be able to be more grounded, and be able to change directions much better. And so Then you look at, say, the squat. So we're looking at the activation of EMGs, if we had those hooked up, of a squat, and these studies have been done. And our firing pattern is glute, hamstring, opposite QL. So when we think about Olympic lifting and we think about people trying to get the max number, not per se performance, we externally rotate at our hip, we externally rotate at the feet, and that firing pattern is now not glute, hamstring, opposite QL. So it changes the firing pattern. And so kind of making those parallels, your power position plays into a toes forward model. And so kind of just elaborating a little bit on that, talking about your power position.
Yeah, so rigid lever, for those that are listening and are not familiar with that, if you did a calf raise, the position that your foot is in when you do a calf raise, that's a rigid lever. Now, that position of the foot, we need that position for taking a step, for ambulation. So evolutionarily, which is what I'm fascinated in, evolutionarily, that ability to achieve that position or a lever was necessary for the advancement of our ability to walk. If we were not able to become a lever, we would not be able to take long strides, which means we would be walking shorter. That's less efficient because you don't get this reciprocal arm movement. When people shorten their step, the tendency to rotate your pelvis and your T-spine decreases, and same thing with the arm swing. You don't get fascial winding and unwinding. So you essentially just kind of tighten up, which means when you walk muscularly versus fascially. That's obviously very inefficient. And from an evolution perspective, that's not good. You have to be efficient to evolve, to be one of the survivors, right?
Yeah.
So now, to take that a little bit further, so that's why our foot is able to get into that position, right? It started with walking, optimal walking patterns. Now, when you look at athletics, you can kind of take it the next step and look at the mechanical movements that are involved, which is what you were explaining, right? What happens when we get into a plantar flexed ankle position? Oh, well, your ankle, which is connected to your talus, causes an external rotation of your tibia, which allows you to optimize very tight transverse plane rotations all the way into your hip to optimize your glute. And I feel that the more that we can optimize glute or couple hip extension with external rotation, you're optimizing the power of the hip. And that comes from your strength in the foot. Now I'm gonna take you even further because your toes are on the ground, of course. So your toes are on the ground, and a lever, I don't want you to think of a lever as like I have my elbow flexed right now, right? Like that's a static
those
thing
guns.
that doesn't give you contact, right? So my foot is in a lever, but dynamically, when I'm going up into a lever position, my toes are pushing down. So an action lever is what I'm referencing. Toes pushing down taps into what's called your deep front fascial line and muscle synergies in the brain that toes down connect posterior pelvic floor. Your posterior pelvic floor myofascially blends into your glutes. Boom, I have two ways that I now just hit your glutes. One was biomechanical coupling. The second was myofascial or co-contractions. And then there's muscle synergies in the brain between your flexor hallucis longus, or your big toe, and your posterior pelvic floor. That's actually been demonstrated through EMG in the brain, or through EEG in the brain.
Wow.
So that's why I train the lever, or I like to train the lever, or teach professionals to train the lever in a way that optimizes that. So if you've ever seen the exercise where you put a ball between your heels,
oh yes,
you
yes.
lift, have you seen that? Okay, a lot of people do it wrong because they're just watching something on social media and it doesn't translate. What you want to be doing in this exercise is that, picture there's a ball right between your calcanei, your heel bones, okay? And as you start to lift to do a calf raise with it between your heels, you are starting to press your heels into the ball.
Mm-hmm.
That just activated your post tib. You're pushing your toes into the ground. Now I just activated your deep front line or your foot to core stability. And then as you lift higher, you're going to tuck your heels. And if you can tuck under the
Yep.
ball. And I just locked. Yep, I just locked into inversion, which drove the external rotation into the hip.
Okay. That makes a lot of sense. That makes a lot of sense because that power position helps optimize glute activation is kind of where you're saying when you're squeezing that ball, we're kind of getting into this position with our heels, correct? Like inverting?
Yes, but you have to train yourself to do that because if you just drive your heels together, that doesn't mean you will necessarily do that at the
Yeah.
top. And I have some videos on my YouTube and social and stuff like that where I show this little pop at the end. And I do a lot of rigid lever assessments, and I teach people to do that in my workshop. And a lot of people will come up into their lever, but their subtalar joint stays neutral. If you're not maximally inverting your subtalar joint as you lift, you are not getting the full, peak rotation into the lower extremity.
Okay.
And I want to add cleats. Cleats restrict this.
Mm-hmm.
Shoes restrict this. If you take a shoe and you try to twist it, I'll just do it with the insole, and you twist a shoe, right? You can't do that with a cleat, right? That there's not that motion. That's going to block your subtalar joint from doing that. So you actually disconnect or you don't get the full, let me call it follow through. If you're throwing a ball, right, or swinging a bat or whatever, there's follow through. So the lifting of the heels has that follow through, or you essentially cut the energy flow short.
Okay.
Does that help?
No, that definitely helps. It really does. We have, and it's obviously to the extent of my understanding and my training, we do a lot of what you would call rigid lever work, a lot of active foot stuff, we call it. So we're obviously in that plantar flexed position, and we're doing a lot of heel elevated or truly just being as tall as we can in plantar flexion training. What we're looking for mainly is in a lot of sports and traditional strength and conditioning, we were taught knees don't go over toes. Never let your knees go over your toes. But actually, we're trying to train that pattern. So being in that active foot or that plantar flex position, obviously calf raises can do it. But what you just demonstrated shows that there's much more to it than just doing a calf raise. And then a lot of isometric holds is where we've seen a lot of failure in athletes. We've seen a lot of people truly in whatever sporting arena it is, but putting them in an isometric position in an active foot or a plantar flex position shows a huge weakness. And I have that with some of my highest level athletes. You're going to see that weakness start to show itself pretty quickly. And so we do a little bit of that, obviously looking at a main thing when we're looking at athletes, and this is one of the questions, when we're squatting, is ankle mobility an issue for that squat? And you'll see that. I mean, if you have a trained eye, you're going to see that right away. I mean, it's going to be there. And so we look at that, but then once we get past that, once we have sufficient dorsiflexion in that foot, we will move into more of that plantar flex position.
One little aside that I want to add for you and the listeners that you want to think about is the more you go into plantar flexion. So let's say you keep training the lever and they go as high as they can, and maybe some of these athletes can go quite high, or some of the sprinting position that they may go into is your talus, and depends on their injury history. Let's say they have a history of ankle sprains or ankle injury. They potentially may be causing a loss of centration of the talus bone. So your talus can shift forward, and then when they go into a dorsiflex position, they hit a bony block and they don't have ankle mobility. And the issue is not soft tissue. It's not tight calves or, lengthen your Achilles tendon and things like that. it's that talus bone has to be recentered. So I see that a lot, especially the more that you run or you get into that lever or you hold the lever, you stress the lever, and they have a history of ankle injury.
Mm-hmm.
I just have on the back of your mind that perhaps their talus shifted forward. I have a video on my YouTube channel, EBFA's YouTube channel, where I'm speaking about a posterior talar mobilization and losing ankle joint centration. And I show a technique that is, there's subtle, specific things you want with that mobilization.
Okay.
Just in case people have seen it on other videos or social media and things like that, is the subtlety of the band placement, the line of pull, they have to be higher. There's all these, they have to be in neutral. There's a lot of things that you want to make sure are done so that you get success of that talar mobilization. But having said that, with these ankle injury histories, the talus might be forward.
That's interesting. We do, so I think you're explaining the exact same movement that I usually do with people. So we'll do a wall test, seeing how much dorsiflexion they can get into. And then one of two things usually happens, and this is obviously a general statement, but you either feel this tightness in the calf, where usually, I mean, depending on the person, 90% of the time, you're either going to feel it in the belly of the calf, or you're going to feel it lower into your Achilles. And so then if they feel it there, that's fine. I can work with that. If they feel like a pinching sensation in the front side of that ankle, we usually, and this is interesting because now I'm learning about it and I can take it further, we do what's called the banded ankle mobility or the banded ankle mob, and so obviously there's a specific, and I'll have to talk to you about that, but a specific placement of that band to be able to pull that back. And then another question, can that be, if done right, can that be sufficient to relocate that, or do you have to go get, say, adjusted?
Nope. So you can use the band mobilization to recenter the talus or mobilize it in the way that you were saying. You wouldn't have to go get an actual physical therapist, chiropractor to readjust, mobilize the ankle. The exercise that you're referencing, or the mobilization, one of the most important things is that the band is below the malleoli, it's below the ankle bones, which means they have to be higher than the floor. You can't pull straight back or down when the floor is there because they have to be higher.
So the line, so you're saying it has to be below, and then it has to, the line of pull has to be higher?
Has to be down. So they're on a step. The band is around the front of the ankle, but below the malleoli.
Mm-hmm.
And then the line of the pull is down, but it's actually down and lateral because I'm trying to follow the talar neck. I teach deep hip joint centration band mobilization as well. And the positioning of the line of pull is very important because of the shape of the joint surface and the femoral neck, or here the talar neck, and how it's within the ankle mortise.
Very interesting. I'll have to, I'll look at that too, because the band placement seemed correct when we're using it, but that lateral aspect of it, it was always just a very linear line of pull. And so I'm going to have to look that up. That's awesome. So that kind of gets us into this concluding segment that I wanted to talk about that's very interesting. And so right before that, and this can be, I know, very multifactorial, and I deal with when I'm training the basketball team. And I don't know if you remember, but at the college there's this surface or this gym called the Weinbergen gym, and the surface is terrible. It's bad. So they were trying to make a very giving surface. So they put a concrete underneath with springs that are very deep where you can't feel the actual spring effect. But then they put another thing of concrete, and then they put you can push your fingernail into it, and it's very spongy surface. It's hard and it's rigid, but you could actually feel the give in it. And we deal with, and maybe because they try to stay away from that as much as possible, but they deal with a ton of shin splints. People that on that basketball team, they've been plagued with it. So obviously that could play into it, but what are the factors, some of the factors that lead to a shin splint? Because a lot of times, more than likely, it's going to start in the foot.
Yes. So I look at shin splints as a vibration injury. And I'll tell you what vibrations are. So impact forces, every time your foot hits the ground, you are experiencing the relationship, it's gravitational relationship between your body and the ground becomes ground reaction forces or impact forces. That is perceived by your body or sensed by your body as vibration. It's not pressure, it's not pain. I'll ask people, oh, how do you know how hard you're hitting the ground? And like, what is ground reaction forces? And people never took a second to think what that is. It's vibration, and vibrations coming into your body are, one, your body's potential energy, so they're good. You need to know how to harness impact forces, vibration as energy. But if you have excess vibration, or you do not know how to control the vibration that's coming in, it has no choice but to go into your soft tissue, plantar fasciitis, and your bone, shin splints, and stress fractures.
So does that come down to like neuromuscular control of that force then?
Yes. So the way that we stop vibration, the way that we stop it or control it is through isometric contractions of your muscles that are knee down. So your lower leg and foot contract isometrically, dynamically to control movement. And when they contract, they create like a splint. So think of your two leg bones, tibia and fibula, that sit here, and then around them, surrounding them, are long groups of muscles that when they contract, they harden, just like any other muscle, right? They stiffen, and then they act like a splint, or like the brace or the splint. Now, if the timing of contraction of those muscles is a little bit too slow or insufficient from a peak muscle contraction, then it's not splinted well. And what happens to your bones is they bend. So shin splints is a bending of your bone, and you're essentially going like this with it. So what I do with patients who have shin splints is I look at what is affecting the timing of their stabilization response. Is it that they are not perceiving the ground fast enough? Shoes, maybe. Is there too much vibration coming in? They're running on concrete. Concrete doesn't vibrate. You get all the back reverberation. So they're just hitting a fatigue point. Is their foot type? They have a pronated foot, which is a little bit slower foot. So they're just not getting that stabilization fast enough. Do they have a history of injury, which is making them a little bit slower because of the break in neuromuscular control? Is it, something proximal? Do they have, glute weakness, blah, blah, blah? Do you see how I can start to go into a long list of things that cause it?
Yes, definitely. I learn something new every day. I like that. It makes it a little bit more simple and shows a lot of time, the best indicator of injury is previous injury. And so that might be a big indicator, because me looking and just analyzing my basketball players, a lot of them came from junior college and they've had those ankle injuries. The very high level athletes, people that are very good athletes, maybe caught a break here or there that they couldn't go D1. And so I think that's a big issue, and obviously it's going to be on a case-by-case basis, and so I can bring that definitely to them. I really like that.
I will add, just as a bonus, is the compression sleeves that people will use with shin splints, so that people can understand the science behind them, is that they increase, actually let me go back one. When you contract your muscles isometrically, because they sit in little compartments, you've heard of compartment syndrome,
yep.
Right? All of our muscles are housed in compartments. When you contract your muscles isometrically, they stiffen to splint, but they actually increase your compartment pressure. So the higher your compartment pressure, the more stable that body part is, we'll say. Like your core, you engage your core and they all co-contract so that you can increase your intra-abdominal pressure. Same thing in these compartments, you need pressure. A compression sleeve increases your baseline compartment pressure so that the muscles don't have to contract as fast and you are stable. You have sufficient stiffness or pressure at foot strike. That's how they work.
So do you, because then you look at like, let's take strength conditioning. You look at the use of a belt to increase the pressure of a Valsalva maneuver, of increasing that intra-abdominal pressure. You don't want to use those for every single thing you do. And so do you recommend this compression sleeves? Because from the sounds of it, very basically put, if you use a belt for everything, it turns into a crutch. And then those muscles don't learn to actually provide sufficient rigidity. So, used in intermittent timings, is that better for the sleeves, or what's your thought?
So the compression sleeves, just like a lot of athletic gear, was for very specific athletic purposes. Mm-hmm. We'll say more like ultramarathons, where they are exhausting their neuromuscular control and timing, and you're essentially trying to push their fatigue threshold further away so they can do an ultramarathon. Of course, people want to kind of come full circle, and now people use it when they're just doing squats at the gym or something. I like to use compression sleeves, one, when an athlete is injured, right? Because you're trying to get them into a window of control, get them out of pain, get them quiescent. That's always your first step. And then you really do want to try to get out of the compression sleeve and build in sufficient neuromuscular control. Now, that is an art, that's not a science. So that's working with the individual on how they're responding to your training. This is where I do a lot of foot to core fascial training and short foot and barefoot to get them to be very isometrically fast, that you can start to deviate away from that compression sleeve. The only way that I would recommend those, here's an example, is I had a track coach who took one of my workshops, and they were from Minnesota or Chicago or something like that. And they said, oh, well, our track season starts when there's still snow on the ground, and they didn't have an indoor track. So they would sprint in the hallway of the school. And I'm like, oh my God, you are sprinting on concrete. What are you doing? Okay, so I said, you are going to be getting higher vibrations than you should because it's concrete, it's tile, right? It's just science here. That I said the athletes during your preseason running on the concrete, if you have to, technically I don't think you have to, just do some kettlebell conditioning in the strength facility or something, is use the compression sleeves then. Don't be in a true minimal shoe, maybe have some cushion for that period. Of course, you can have the argument of what is the returns of that sort of training environment versus what I just said, and do cross training, kettlebell training, and all of that. That's what gymnasts are now doing, is you don't have to do 10,000 back handsprings to build the conditioning for a back handspring, right? You could do these other types of training. But that would be an example that I would say to use it, is if you know you're in an environment that has unnecessary increased vibration and you're trying to hack your system to better damp those vibrations. Concrete would be an example.
Yeah. A big thing that in the sport of basketball too, more so than many others, they are always in basketball shoes, which are highly supportive, very tall, very cushy. And so almost always, it's about 99% of the time, maybe a few exemptions, if they're in the weight room with me, they are barefoot or in socks, because a lot of them struggle, because with basketball, it's such a technical thing. You're either in practice, you're either shooting with your friends or playing pickup games. And so you're always in these shoes. And so that's something with a very low barrier of entry that we've been able to do, is just let's get you out of shoes for as long as we can. And it seemed to help.
Yeah, that's the way when I speak at NSCA and these other strength and conditioning conferences is how can we start to just sprinkle this in to build some balance in the foundation of these athletes,
Mm-hmm.
knowing that a majority of these athletes are shod. They have to wear shoes.
Yeah.
So exactly what you said is when we're lifting, could we at least be in our socks? I would love it barefoot. I get that there's certain barriers to that, but if you at least get them into a zero drop sock, spread the toes, and then honestly, that's where we use Nabosos. We say when you're in school, like you're going to classes or you're walking around on the weekend, whatever your downtime is from a shoe perspective, is have something like that in so that you can at least detrain some of that structure of the basketball shoe.
Awesome. And I don't want to take too much more of your time, but I just wanted to touch on this very, very briefly. So a lot of the injury reports have been out about the NFL now, and they're seeing this year due to many different factors. And I truly believe that a lack of training in a detrained state has caused a ton of that. Then we look at the overall, and so I got this number by they updated as of Thursday Night Football, so that it was very up to date, and they had broke down for every team. Then they had for every single injury from start to finish of this year, and then they had lower body, upper body, and what it was. And so I went through and actually counted all the lower body injuries, and all the lower body injuries up till Thursday. There's 321 lower body injuries. That's fascial injury, that's ankle, that's structural, whatever it is, but those are all lower body. And so then that gets us to the point of like this data set that I sent you. It shows that not all NFL body parts are created equal. Out of all the injuries, 86% of the injuries were made up of just the knees and the ankles. That's including when they're saying knee down, or knee with the hamstrings, anything like that. So it's very interesting that these injuries have completely sidelined some of the best players. You look at, the best players in the game right now, and they're sidelined. My thought is the detraining effect. People weren't ready to hit the ground running. Also, the preseason was taken away. A lot of the preseason, you talked to John Welborn, who actually played in the NFL. Those were the times just to get your feet underneath you. You played the first half, the first quarter, got into football shape, whatever that means. So I want to hear your thought on what are we seeing right now. In 10 years, we're going to look at this data set and be blown away. What are we seeing right now, and why are these things happening at such an increased rate?
Yeah, I agree with you 100% on this decondition. They weren't ready to be at the level of deceleration, acceleration of game time and opponents. And it's a lot of also dual tasking. So I look at these as really neuroscience, we'll call them,
Mm-hmm.
meaning that some of it is proprioceptive. Both the ankle and the knee are two very high proprioceptive dependent joints. They are also very much reliant on how quickly your feet and your hips are talking to each other. If you have weak hips, weak glutes, just a little bit of delayed stabilization in your glutes, your knee is going to suffer and your ankle is going to suffer.
Mm-hmm.
And same thing with the foot. The foot is so important to how you stabilize both of those joints as well. So I do think that it was the inability to have a formal preseason where they do these preseason games to, like you said, get into like football ready.
Mm-hmm.
And what I hope people also think about is the dual tasking process of these athletes is very high, and they're constantly under a high decision making process. And when you get into dual tasking and you haven't properly conditioned dual tasking, or the ability to subconsciously stabilize your joints while making decisions facing an opponent and strategizing with your teammates of where you're going to go, etc., what suffers is the subconscious stabilization pattern. So I think that may be some of it as well. is they didn't do all aspects of training to the same degree. They weren't doing these mock games that gets them kind of football ready in a sense. And that mock game, what that trains is that rapid decision making and stabilization patterns. So to me, it's very unfortunate. I remember when 4 weeks ago, I was starting to see some of the stats or was watching some of the games that would be injured, injured, injured. It's sad because these are potentially career ending because one injury opens Pandora's box to successive injuries. And it was, in the names of the power that be that wanted to push the sport on, which I get it, it's a business, but it's at the cost of these athletes who are so passionate about the sport and are so talented that I hope that it doesn't end too many careers.
I hope so too. It's scary because you just hit it on the head, and I just said it a different way earlier. Is the best indicator of injury is previous injury, and a lot of these people. We just had Odell Beckham Jr. go down. We've had a lot of people with Achilles and MCL, ACL, all that, and so it definitely is interesting to see. And you said it right; it is a business, and without them going, the money's not there. And so, lastly, this gets us into kind of how I talked about the difference between NAI in Dickinson, North Dakota, compared to Division I at Clemson. These athletes are producing much more force at a much quicker time interval, which is rate of force development. That's what we're trying to increase in our athletes. And a lot of the preseason games, when we say football shape, I think that's just strictly put neuromuscular control and being efficient and being able to perceive the ground at the right rate and X, Y, and Z. It's multiple factorial. But we look at these people, and this data set shows that some players are injured much more often than others. And then you look at also the speed of those players and the speed of that play. Almost a huge majority of them are wide receivers, outside linebackers being a lot quicker, and cornerbacks. And so those are a big data set of people getting injured. Do you honestly think it gets us back to the detraining effect, not having the neuromuscular control that they did previous years, and just the rate at what they're producing, because wide receivers are at a much faster velocity than, say, an offensive lineman?
100%. I look at everything as timing. Hands down. When I teach a workshop or I look at a patient, it literally is the timing.
Yeah.
The timing of the stabilization, the timing of the force, the time under exposure to that force or to that stress, whatever it is. And then if you have external stressors coming at you, meaning another player, their rate, timing affects things as well. So 100%, I do think that that's what it is.
Okay. Well, I try to mix up about every 3 to 4 weeks of a question that I'm going to ask a guest at the end. And a good one, and I can elaborate on mine later, or we can just skip that. It doesn't matter to me. But if Dr. Emily wanted to be remembered for something, what would that be that you want to be remembered for when the time comes?
I would say for disrupting paradigms around foot function being purely biomechanical.
Ooh, there you go. I like that. And lastly, this is one of my favorite ones. If you were a kitchen utensil, what would you be, and most importantly, why?
I would be the coffee maker.
Ooh, that's a new one.
Because I get you ready for your day.
I like it. I like it. What did I choose? I had a fork because it's just the best thing. You can cut with it. You can eat with it. The only thing that you can't do is eat soup. And then I also said a meat tenderizer, because I'm usually all gas, no brakes, just kind of go at it. So.
That's awesome.
Yes, it was a pleasure getting to talk to you. I I was able to learn things that I didn't necessarily think that had more depth to it, and I love that. That's the reason why your profession is there and what you're doing for the profession. Where can people, a few things, where can people find you on social, and where can they find your products, and more importantly, EBFA?
Yep. So my personal social is at Dr. Emily BPM is my Instagram. Facebook, just search me. Naboso is Naboso is the brand Naboso _ technology. And then our website for Naboso is naboso.com, naboso.com. And then EBFA, which is the education company, is EBFA _ barefoot education on Instagram. And then our website is ebfaglobal.com. But I tell people, if you put Dr. Emily Barefoot or Dr. Emily EBFA, you will get literally everything you want.
Awesome.
Our YouTube has 250 lectures on it that are free.
Wow.
So I do webinars every month, and I put a lot of free content out there for the purpose of advancing the professions. Of course, it's still business, but
Mm-hmm.
I think it's important to just pique that curiosity and start exploring it, and then know that it is a very deep rabbit hole you can dive down if you want. And I love people that take that journey with me and then apply it to their sport, to their profession, and then impact more lives. So it just becomes this whole kind of spider web of impact that we're able to have.
Amazing. Again, I'm honored to have you on. I appreciate you taking the time, and we will be in contact. I'll post up your stuff where you can reach everything and find everything you need. So I really do appreciate it. Everybody, that is another very interesting, very fun NLX2 podcast. Leave us a review, throw it on iTunes, Spotify, whatever you do. Thank you again, Doctor.
Of course. Thank you.